core foundation of the patient-client relationship. Just like I told you earlier, cancer is a doctor-patient conversation, and such communication, however, can be challenging. Concerns even then these concerns about professional helplessness, even when caring for a patient with the disease with a poor prognosis, you'll even desire to avoid difficult patient and personal emotions will lead to unstable reluctance and even share difficult news with patients and family. So this is where there is the relationship between the patient and the doctor to know what is and what isn't, what to do moving forward once the information is shared that this is what they have. Find the right words maybe to balance hope where it concerns and sharing difficult news, of course, insufficient time to attend the patient's emotional needs, even the fear of negative impact on the patient. Receive prognostic information about can be difficult even for patients, and even not receiving that information will tend to create anxiety and may distance patients from um, their team of care who often aware who are often aware of the prognosis but not share it even with the patient. Um, Delaying or even avoiding communication about the prognosis also risks patients for not having information. They need to make decisions that leads to missed opportunities to set and achieve goals that also reflect matters that are most important to them. So um so uh when we are doing domain 3, it's about the counselor and what to do moving forward, because there's a lot of challenges that are going on, and of course knowing that there is there's this and this going on with this person, and even the progonistic information of the procedure being done, patients need time to take information in to let it sink. And of course, with insufficient time, if they're not given that time to accept what they have emotionally, uh, and the, the, the negativity of the patient, they all of a sudden change from what they want and to what they'll be. Of course, the approaches um, are there, bad news and good news flow approach, positive farming approach, the aspect of prognosis to be emphasized, aspect of prognosis and aligned implicit prognosis, quantitative, qualitative method of providing information, of course, general counseling and scenario analysis. So this is just one example. So all this will be available on a link above if you just click it, and these notes are there. So for me, I'm just going through them, but they'll be on a link. They'll be on a link in the description, and of course during the comments they'll be there. So approach 1, approach 2, 3, 4, and of course 6, 5, and 6, and the need of counseling to class counseling and will help them to get rid of the burden and all that they are they have in their mind. Of course, this the share model. Seek patients participation, help patient explore and compare treatment options, access values and preferences, reach decision, or is your patient, of course, evaluate the patient's decisions. And patient-centered care is a partnership among practitioners, patients, families to ensure that the decisions that the patients make are well respected, and of course patients have their education and support they need to make the decisions and support they even make participate in their own care, and of course which brings about the improvement. So I'm going to rush it a little bit so that at least we finish cancer a little bit earlier, so that we get to do other things, discuss a lot, and there's a lot of data it as far as cancer is concerned, but I have too much PowerPoint presentations, but I'll generally sum it down. This is just going through. Of course, this is program the parentalist professional. This is the start displayed biologically. Of course, clinicians possibly affect patients' perception of prognostic content to identify the communication style, directive, more physician-centered, and effective, more patient-centered, and of course, direct style, and of course, the parentillistic professional attitude use of medical jargon during the patient-physician communication are even more. Concepts of the patient-centered communication. The core concepts of the patient-centered communication include eliciting, understanding patient perspective, understanding even the patient's unique social and cultural contexts, of course, reaching and understanding problems. And this the patient-centered communication, perceived lack of time, and practitioners may feel they lack enough time to listen and even explain, negotiate the patient. Even sometimes they are not able to fully articulate the initial concerns, interrupted by the provider because um there's a lot going on in their mind, and of course they need to understand what they are going through. Of course, ask open-ended questions, avoid interrupting, um, negotiating evidence, provide attitude can be a barrier to effective patient centered. Positive or even negative attitude. It can affect positive and even being there for them. Important. I've mentioned the patient decision making. As you can see, I have a small diagram there that's parenalistic informed medical decision making. The social elements shared in decision are even defining the problem, present options, discuss even the values and the preferences, discuss the patient's ability, doctor knowledge, check even clarify understanding what they need to know, what they need to confirm, of course, make the decision whatever they're happy with, and of course, there's the following up. Oh, lastly, there's the important role in patient-centered communication, which includes listening actively, assessing the patient's understanding options, validate even the participation in the decision making process, even communicate empathy both verbally and non-verbally. So decision making generally helps patients move forward and can be improved through aids help them understand the treatment options, and they become more active in the decision making. And of course, a decision aid is a tool that helps patients provide evidence-based objective information on treatment options to give even the options for a given condition. Decision aids can present risk benefits of for all options and help patients understand what their likely taste benefits that will harm them, and of course includes written material, web-based tools, videos, and even multimedia programs. So thank you for staying tuned, me. Thank you for taking account and even making the difference.